Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 5, introduction. If you are new to tissue salt therapy, in short TST, viewing part 1 is a must. Please remember this. If you already know something about tissue salt therapy, you can skip part 1. But if you are absolutely new, then you must see part 1 first. A few most important instructions as to is administering medicine. Number 1. In acute diseases, when patients tend to cure, try gradual higher potencies. Number 2. In chronic cases where patients tend to improve after administering high potency, sometimes repeated application of low potency leads to achieve cure fast. Number 3. Do not change the potency which paves the way to recovery unless the same does not show any positive result after applying a few times more. It is continue. If there are two dots on the starting, you please understand that it is continuation of the last heading. Number 4. During active phase of an acute disease, sometimes medicine need to be administered every 5, 10, 15 minutes interval. In such a situation, dissolve 10 to 15 grains of selected low potency medicines in 150 to 200 ml lukewarm water and then give 1 teaspoonful of medicine a time. 1 grain equal to 60 milligram approximately. This is simple information. You did not know this actually. 1 grain is 1 grain, that is medicine available in that fashion. 1 grain, 2 grain, 3 grain. In India, it is always 1 grain. Number 5. For a newborn baby, less than half a grain of medicine is dissolved in a teaspoonful of lukewarm water and is poured in its mouth very slowly along a corner of the mouth, as shown in the figure. Number 6. All phosphoricas work better if used with lukewarm water. There are 5 phosphoricums. Mind it, phosphoricum and phosphorica are the same thing. Both way it is okay. Cp, calcareous phos, Fp, ferrum phos, Kp, caliphos, Mp, magnesium phos, Np, natrum phos. All this phosphorica works better if it is used with lukewarm water. Because you know phosphate salts are readily soluble in lukewarm water, not in cold water. Continuation 7. Generally, tissue salts are administered in solid cap in mouth of a patient and is requested to keep the patient under tongue. That is, the patient is asked to keep the medicine under his tongue, for in that case, the medicine is dissolved in the saliva and is easily absorbed by the capillaries of the floor of the mouth to start action promptly. This is the most universal approach of applying medicines. Give medicine in dye form, say 3 tabs or 2 tabs or 1 tab, whatever you want to give. Give him a tab in his mouth and ask him to keep it under his tongue. Within 2 or 3 minutes, it will dissolve and it will beautifully absorb in this system. If he just simply swallow it or just he munch the thing as like foods, it will be less effective. The medicine will be less effective and that fashion. In this fashion, that is keeping under the mouth, keeping under the tongue is best. Number 8. For patients suffering from incurable types of diseases where providing just relief is the objective, employ only low potency of medicines. Never try high potency, for the latter may cause severe aggravation. Continuation 9. In ordinary acute diseases, generally medicine of 3-6 potency are employed in 3-4 times a day. If necessary, higher potency medicines may be used later on. Number 10. In chronic diseases, medicines of 30x, 100x, 200x potency are used every 3 to 4 days or 1 week or more interval. 11. Sometimes there may not be any need of medicine for a patient, yet she or he presses for medicine. In such a situation, never rebuke him or her. Give phytum or nihilum with strict rules. What are the concept of Dr. Grovel regarding constitution of patients and potencies of medicines? This is a unique approach. This approach is available in homeopathy and tissue salt therapy. No other therapies. In no other therapies. According to constitution of patients, different potency of medicine may be used for the same disease. Dr. Grovel, as to this concept, divides all curable patients in three distinct types. Number one, hydrogenoid constitution. Patients of this constitution suffer much in wet, rainy, marshy environment. For such patients, low potency like 3x, 6x, 12x are appropriate. Number two, oxygenoid constitution. These persons are of tall, thin stature. Their sufferings increase during change of weather. They feel well in rainy season. They generally need potencies between 12x and 30x. Number three, carbo-nitrogenoid constitution. Patients with this constitution used to suffer from epilepsy, heart and lung diseases. They have tendency to suffer from pain of extremities, that is hands and legs. For them, medicines with potency between 30x and 200x appear appropriate. Mind that all patients cannot be grouped in under these three. There may be a lot of patients which will come none of this 1, 2, 3. That doesn't mean that they cannot be treated. They will be treated according to their present symptoms and signs. But if you get this constitution, then it is an added advantage. Meanwhile, you must have understood that these 12 salts, the name of the 12 salts on the right hand side, that's why I am just showing here, the name of the 12 salts and their salt number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 are fixed. That is, you cannot detach the salt number from the name of the salt. Salt number 1 means always calcarea fluoricum. Salt number 8 means always magnesia phosphorica. Silicia is always salt number 12. Now, how you can remember this name at the tip of your finger with the help of the tip or rather chords of your fingers? That I have designed a mnemonic in my own idea. It is not fixed. You may prepare your own, but what I have prepared, I am just clarifying. First, what I have done, all the 12 numbers I have written this 1 to 12. Then the first letters of each salt. See this, calcium, 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 so K, K, K. Then ferrum, that is Fe, so Fe. Then kalium, 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 so K, K, K. Then magnesium, so Ma. Then sodium, 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 so Na, Na, Na. Lastly, silicia, so Si or Sil, Sil. That I have written. Now, the lower line. This each salt has got two portions, cationic portion and anionic portion. The cationic portions, anionic portions, first these are cationic portions. Short name of cationic portion. These are the short name of anionic portion. See this. Fluo means fluorica, phos, phosphorica, sal, sulfurica, mu, muriate, tica. In this way, I have written all these things. Now, how will you remember? Note this thing. K, 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 fe. K, 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 ma. Ne, 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 si. Fourth, eighth. First thing, you just separate number, salt number 1 and salt number 12 because they are unique. They are unique. There is no extra fluorica. There is nothing about silica everywhere. So first you separate 1 and 12. But you remember this K, 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 fe, K, 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 ma, ne, 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 si or sil. That is a very fundamental thing that you have to remember as per your chords of the fingers. K, 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 fe, K, 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 ma, ne, 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 si. Then comes in the lower portion. First thing, you separate out number 1. Calcarea fluor is exceptional, so separate it out. Silicia exceptional, separate it out. Now, 2 and 3, and next you separate the 4 and 8. You will also separate this because 4 fe phos, me phos. So you separate also 4 and 8. So in this way 1, 12, 4 and 8 are separated. Because these are either they are unique or there are some similarities. जैसे कि number 4 ferrum phos, magnesium phos. Now about this KKK, note this thing, mu phos shell. About this NNA mu phos shell. Do you remember this similarity? Muriaticum, phosphoricum, sulfuricum, muriaticum, phosphoricum, sulfuricum. Number 4 is also separated phos. Number 12, number 8 is also separated phos. 12 is separated silica or silicea. 1 is separated calcarea fluorica. Thus, you got some technique to remember things. KKK fe, KKK me, still. So these are for cationic portion, and anionic portion. You remember that first is calcarea fluor, last is silicea. Then fourth and eighth both are phosphorica. Both are phosphorica. Then 5, 6, 7 mu phos shell, 9, 10, 11 mu phos shell. So what are the remaining 2 and 3? 2 and 3 is phos and shell because there is no mu. Calcarea muriaticum is not available anywhere. So this is not there. So this is the plan of remembering Scholl number. I have designed this and I have also been able to remember this thing in this way. But I am again saying you can design your own because you have to remember these names at your fingertips or on the marks of your fingers. Thank you for listening and viewing. The video ends here. If you have got anything to say, please write down in the comment section. I will certainly respond.